Good afternoon once again. I'd like to welcome everybody to this webinar series titled Polio Eradication in Africa, Lessons from the Polio Outbreak Control Rooms in Improving Outbreak Response. Without much ado, I'd like to introduce our guest panelists who are here with us today, starting with Dr. Kuzias Yambo. Dr. Kuzias Yambo is the National Pediatric HIV Chief Mentor, as well as the lead HIV and TB for the ECHO program of the Ministry of Health in Zambia. Welcome, Dr. Kuzias. And also here with us is Hassan Ali. Hassan works with the National Institute of Health in Somalia, and he also doubles as the National Public Health Emergency Operations Center Manager for the Federal Ministry of Health, Somalia in Mogadishu. Welcome, Hassan.
Thank you, Sadipa. It's a pleasure to be here. Thank you.
Thank you very much, Hassan. Dr. Kuzias, can you please confirm that you are with us and that you can hear me? Could the technical team please help confirm? Would need Dr. Kuzias to quickly respond so that we'll be able to proceed with the webinar. All right, whilst we are doing that, I think in order to save us time, I would like to invite the Deputy Director of Program and Impact to give us his welcome remarks.
Thank you, Seun, and happy to also be part of this. And I'm glad that we also have our guest panelists joined us today, including our participants as well, our guest participants as well. So we are honored to have everyone joined us in this edition of the webinar, Insight Webinar, being moderated by eHealth Africa. Just to highlight that reason hosting the webinar feature because we need to offer a platform where we are discussing critical public health innovations that have help in addressing emergencies. So today we'll be talking about polio emergency operational centers or response centers have been able to play a role in achieving polio eradication, right, across countries in Africa where this has been set up. I think it's important that we get to learn how self-innovation has impacted in addressing public health in Africa. I just wish our guest participants will really have contribution to this conversation as we listen to our guests, speakers, or moderator take us through some very interesting piece of work. So thank you for joining us, and I'll leave it here for now and hand it over back as we move to the session. Thank you.
Thank you so much, sir. So just to provide a background as well here, we all know that this past Monday, 24th of October, we marked the World Polio Day. And this day in particular challenges us, especially those in this space, to take a stock and assess the global response to polio. In this wise, we're talking about how far we've come and what's left to do in order to rid the world of polio. And over the past decade and a half, we all know and we can all agree that polio outbreak control rooms or public health emergency operation centers, PEOCs, depending on the nomenclature we want to use, have been critical to the steady progress and declaration of most African countries as being world polio-free. Now, I want to raise the point here that the centrality of the EOCs or the POCRs in responding to public health emergencies cannot be overemphasized. This is further corroborated by the declaration of African Union heads of government at a recent meeting in July 2022 in Zambia, where they all took a collective decision to establish and strengthen existing public health emergency operation centers in 90% of African Union member states by 2026. Now, this result, like I earlier mentioned, shows the centrality of POCRs or PHEOCs in the fight against not just polio, but other vaccine-preventable diseases as well. And with this, I would like to invite our panelists to share with us their opening statements, starting with Hassan. Hassan, could you please share with us an opening statement? Thank you.
Thank you. Thank you very much to the Deputy Director, Mr. David Akpan. Thank you, Dr. for moderating. Assalamu alaikum, everybody, and good afternoon. And my name is Hassan Muhammad Ali, and I'm the National PHEOC Manager at the Ministry of Health in Somalia. I would like to first thank the organizers, the eHealth Africa team, who have dedicated their time and energy to making this webinar happen. I also would like to greet my fellow panelists, Dr. Kavia. I also have a warm welcome to all the other participants, and I look forward to your interactions in this interesting webinar. For Somalia, currently there are establishing and operationalizing our emergency operation centers in both national and state levels of government. The National Institute of Health under the ministry is spearheading these establishments. We are hoping that the centers become fully operational by the beginning of 2023. And again, I'm happy to open this discussion, and I believe Somalia will benefit a lot from hearing some of the lessons learned from other countries that have been already having working emergency operation centers. And it could be a very good assistance in guiding us in the most effective strategies once our operations begin. Thank you very much again, and I hand over back to you, Dr. Salipe.
Thank you so much, Hassan. And with that, I would like to invite Kozia to give us his opening statements. Kozia, please.
Good afternoon. Thank you. I hope you can hear me now.
Yes, we can.
Thank you very much for giving me an opportunity to participate in this webinar. It's a great privilege and honor for us here in Zambia, and just getting to collaborate with eHealth Africa, who we recently met in Zambia as they've come to provide support to the emergency operating center in Zambia. I think the team was here when we're actually officially launching and the big institute here in Zambia. So I think it's an honor to be here. I am Kozia Ziambo with the Ministry of Health. I'm one of the chief mentors for the HIV program. I also am the lead on the ECHO platform. This is a tele platform that uses technology and virtual space to build capacity among health workers. And I've gotten involved in the polio response because of the same platform that we coordinate from the Ministry of Health. And so in this discussion today, I'll probably be emphasizing some of the work that we have done in terms of building capacity in the HIV program, building capacity in the COVID-19 response, building capacity in tuberculosis response. And so the platform has been very critical in developing healthcare workers' capacity in responding to emergencies. So I really take this as a privilege and an honor. And so we'll be able to just have great conversations this afternoon. Thank you so much. Back to you, Sodipe.
So thank you so much, Dr. Kozia, and thank you so much, Hassan, for the introduction. So going deeper into the reason why we're here today. So I'd like to pose this question to you, Dr. Kozia. Could you please, in your expert opinion, shed more light on the importance of information gathering, analysis, and dissemination to public health response?
Thank you very much. And so in my opinion, information gathering, analysis, and dissemination is actually a very critical issue in responding to a public health emergency. And this is because I feel there are three key responders to any public health emergency. And you have the leadership at policy level, and then you have the implementers. Then you also have the public, the general public at large, who needs to respond to all this. And so we have learned quite a number of lessons from the time that the COVID outbreak happened. Most of the countries, most of the places didn't have any kind of structured emergency operating centers. And so what we have was quite a chaotic way and approach in getting to try and arrest the COVID response. And so information gathering, analysis, and dissemination becomes a very critical issue in the response. And this is well coordinated and done very well using the Public Health Emergency Operating Center, because there you have very well defined and clear roles of what needs to be done, and different teams and stakeholders are brought on board, and it helps to coordinate. And so this ensures that policymakers are given an opportunity to make decisions that are able to respond to the actual needs because of the information that has been actually given. And then you've got, they're able to remobilize resources that meet the demand for the response. And the planning purposes at policy level, we're able to do that because of the information that is being gathered and being analyzed. And then at the implementation level, we have a standardized approach of responding at implementation level, because you have information that has been analyzed, and then now strategies have been developed, and the implementers are able to implement in a more standardized fashion. And at the same time, you have got the same information that when is being disseminated, being disseminated to the public in a standardized format, and it's information that is evidence-based from the things that have been gathered on the ground. And so the importance really of information gathering and analysis, then dissemination, becomes very, very critical in a public health response. It ameliorates any anxieties amongst the general public, and that really reduces any chaos, any riots that may potentially come up, because people want information and it needs to be disseminated in a very coordinated fashion. And also it brings the public to be able to participate in the intervention, because without the public, we're not able to intervene properly. And so, and it helps the public also spread the word in a way they can respond in a very standardized fashion with evidence-based information. So in my opinion, I would put it like that. That's how important information gathering, analysis, and dissemination is to a public health response.
Thank you so much, Dr. Kozia, for that. I myself have been able to identify three key components of that. It's important for the policymakers, it's important for the implementers, as well as being of course, critical to the general public. So with that, going with this background, Hassan, could you please lend your voice to the importance of the national and subnational coordination for public health response? Now, Dr. Kozia has provided us with some insight into the importance of gathering information, analyzing and disseminating this information. Could you please just lend your voice to carry on from where he has stopped to provide some clarity as to what you feel is the importance of national and subnational coordination for public health response?
Thank you very much, Sidipe. I think I agree wholeheartedly with Dr. Kozia on his comments on information and the importance of gathering evidence-based information for decision making. Also, now that you mentioned the coordination, it's another very key factor or very important aspect of responding or effectively responding to public health response within an incident. Without effective coordination and collaboration with all relevant stakeholders, especially subnational and national and partners or stakeholders within a country or a government, and there could be a lot of things that could go wrong when it comes to responding to the public health. It could be very poor with a lot of avoidable circumstances that could be arising if the right coordination is. Coordination is very effective in tackling these public health and there should be systems at place that connects the community level, as Dr. Kozia said, the local governments, the national government, private sectors, external partners, and any other stakeholders coming together to achieve minimum loss and potentially save many lives. For Somalia, and if I put that in personal case, there is, as many know, we are recovering from a civil war that has unfortunately shattered our built institutions and systems. However, we have been taking very big strides in bouncing back and building resilient and strong health systems within the country, with also great support from our donors and partners. The Ministry of Health are continuing on building our surveillance, laboratory, emergency structures, just to mention but a few. And these structures needs to be in existence and needs to be owned by all levels of government and states, whether it's the districts or whether it's the region or the community levels or the health facilities and the national levels. Without all of these stakeholders being connected and somehow in a strong system and coordinating effectively, the public health response will be ineffective, unfortunately. Thank you very much. Back to you, Sadiq.
Thank you so much, Hassan, for that. So coordination is critical to timely and efficient public health interventions. And very critical to this coordination is the availability of information, especially evidence-based information that would help policymakers, implementers, as well as the general public to act in the appropriate manner. Thank you so much, Hassan, for that. So keeping up with you, Hassan, what do you then think, coming from where we have begun from, what do you then think is the place of the POCR or the EOC in achieving health security? Because we know that health security is a discourse that is very popular at the moment. It's a discourse that has gained so much traction. what would you say is the place of the EOC in achieving health security, especially for a country like Somalia?
Thank you. That's a very interesting question, Sodipe. And I think and in order to achieve health security, or somewhat aim for health security, you need to carry out activities that can minimize the impact of public health incidents that could potentially endanger people's lives across populations in nations such as Somalia and across the world as well. And in my opinion, I believe one of the more effective activities in achieving this security is having in place EOCs, not just in specific countries, but across the globe and connected to one another. You know, every country or every specific context has identifiable hazards, and based on wherever they are individualized, and these hazards can potentially strike at any time unpredictably. And one of the EOC's main objectives is to have very detailed contingency plans and standard operating procedures, databases that connects to all levels of health systems, all the way to the community levels, that can be updated and in a live format. All of these EOCs would be connected to each other and have updated and information, should you say, such as logistics and human resources, and many other resources that would be needed in terms of an unexpected an incident that would be needed to inform the decision makers for the most effective and immediate response. Definitely, with an EOC in place, with theoretically the correct procedures, this health security would be much more likely to be achieved than not. Secondly, EOCs, they're also the perfect location for the perfect location for coordination, because an EOC is supposed to have a physical infrastructure and in different locations of a nation potentially. These locations now will allow the relevant agencies and different levels of governments to come together, along with other stakeholders and partners, to effectively pool all resources together and respond to that public health emergency, and making health security much more realistic and possible. For Somalia, we have a lot of challenges in achieving health security, and that is due to many different factors. However, the addition of EOCs will definitely or certainly be one more step to achieving health security in Somalia. Thank you, and over to you.
Thank you so much, Hassan, for that. Dr. Kozia, coming over to you now. We recently completed the setup of an EOC in Zambia. I know that you've had very limited contact with them, but in your words, what would be your expectation of the EOC in Zambia, in Lusaka to be precise, in improving the health security of Zambia as a nation? Dr. Kozia, please.
I have very big expectations, you know, and I do. When we went there, we were very excited to see the nature of the space that has been developed, and in recent times we did provide a training to the team there to be able to run what we're calling the Eco platform, and I think using that platform, it's possible that the health security is something that will be enhanced in this particular case. And this is because health security has a lot to do with information. And as teams on the ground conduct surveillance and pick up information, pick up hotspots. This is information that comes through the labs and then comes to a center like that. It's able to disseminate this information and just share with all the relevant stakeholders who will then be able to mount up an appropriate response. And it might be moving in with a campaign. It might be just information or messages about prevention and all those kinds of things. So it's health security is actually very important, and leveraging certain technologies and certain innovations becomes quite important even for the EOC. And so our expectations really are higher, and we know that an EOC has been established. We know that this will improve even our surveillance when it comes to polio in this case. Thank you.
Thank you so much, Dr. Kuzia, for that. It was really a pleasure working in Zambia. We had the opportunity to be able to build the largest EOC according to size that South Africa has produced so far. It was great to have worked with some really, really wonderful people in Zambia. So moving quickly, whilst keeping an eye on the time, directing this question to you, Hassan, could you just quickly share with us the impact or the expected impact of the POCRs or the POCs that we are setting up in Somalia? At the moment, we are currently setting up the national POC Mogadishu, as well as 2 regional POCs in Kismayo and Dusamare, all of which are different stages of completion. What are your expectations with regards to this EOC strengthening the health system in Somalia to be able to rapidly respond to public health outbreaks, including polio and other vaccine-preventable diseases? Over to you, Hassan.
Thank you very much, Sodipe. I think going back to our previous comments, my previous comments, I will continue to explain and give further updates on your comments on the current status in Somalia. So we have currently, with the support of BMGF and eHealth and Africa, and implementing EOC's constructions across Somalia. So currently we have 3 locations and in construction and nearly to complete. And then hopefully the rest of the locations will be underway after. So Somalia, it has a federal system where there is a federal government and then there are federal member states within that federal government that come under it. And currently there is a working modality and there is some sort of systems in place and allow different levels of our government to work together and our health structures to work together in strengthening the system within Somalia. However, as I've said in the previous questions, the EOCs will make this working relationship much more efficient and effective, as per I've seen from maybe other countries and in theoretically and how it will work. So each federal member states will currently have at least 1 EOC working there, and the national will have 1 EOC as well in the capital city. And these EOCs will be now connected together by systems, online systems and databases and the similar working structures. The staff will all be trained on the same working practices. They will have the same documents and even though some states may vary in their hazards compared to other states and their usual outbreaks, And however, this will be one uniformed working environment, regardless of which federal member states you are a part of, or whether you are working in the federal national government. We also have currently or are about to launch a new system in Somalia called the DHIS2 system that will be connecting all health facilities in Somalia to our surveillance officers, and also to the laboratories within Somalia. And we are very optimistic that the system will be connecting, will be run from the established or the EOCs that will be established soon, and that we can be very well effectively and responding to any public health emergency or threat, and such as polio and other also and vaccine preventable diseases. Also human man-made and hazards, and also natural hazards. Some of the current challenges in Somalia, before we have got to put our EOC system in place, is there are a lot of programs working vertically within Somalia, and on their specific program-specific objectives. And this can now sometimes strain our health system. However, the EOCs should be able to effectively bring all of these programs together in one place, and would make our health system much more resilient, strong, and in a better place than it was before the establishment of the EOCs. Thank you very much. Over to you.
Yes, thank you so much, Hassan. I was able to note so many things from what you said, but one of the critical points that I was able to also pen down and highlight is that the EOCs or the POCRs will serve as a convergence to effectively improve the effectiveness and the efficiency of the Somalian health system. And I am glad for the opportunity that Health Africa is there to support the good people of Somalia. So going on quickly to the final one, Dr. Kozia, could you please just give a final word on what you feel the evolution of the use of the EOCs for public health interventions would look like? I mean, if we asked ourselves 5 years ago that would it be possible for the entire world to be practically shut down because of an outbreak, I'm sure all of us would have said no. But roughly 2 years ago, that was what we experienced. We do not hope, neither do we pray for such occurrences again, but we have seen how the EOCs have evolved to be able to respond to that. So in your opinion, do you see any way in which the use of the EOCs can be improved upon to respond to public health interventions? Dr. Kozia.
Definitely. Thank you so much, Sodipe, for that. And I just want to thank Hassan for sharing some of the work that they're doing in Somalia. Yeah, so I see a lot of potential that we have learned from the COVID-19 outbreak. And if there's anything it has taught us is that we can actually leverage technology to really catalyze our response and to be a bit more organized, to have more reach, and to be able to work efficiently and effectively with minimized costs when it comes to trainings, building capacity, monitoring, providing oversight on different aspects of the response. We learned this as Zambia when we took advantage of the systems that we had established for the HIV program. And there are a lot of systems in terms of movement of transportation of samples, in terms of trainings, and then also using what we're calling the telementoring platform, the ECHO. And so that really pushed the response miles ahead than we would have if we hadn't these systems in place. And so I see the FIOC that has been established to be able to evolve and leverage technology to be able to expand their reach and to be able to improve on what we call situation rooms. These are places where data having been mined and taken is then used as a platform to analyze data and to be able to make critical decisions and proposals on specific interventions as we go forward. So those are some of the things I feel we can learn lessons from the COVID, where we were able to do similar approaches, especially when we started doing the vaccination campaigns. We did conduct quite a number of trainings using technology. And so, and we are really, very happy that we've been linked with the FIOC in Zambia. Already, we've started doing geo-mapping together with eHealth. We are geo-mapping the sites, the eco sites, and we want to make sure that healthcare workers within that facility, in those facilities where they're eco sites, they are able to receive any kind of trainings, receive any kind of support when it comes to the response, especially to polio in this particular case. So really, we know that to build capacity among health workers, to build skills, to improve skills, to monitor the campaigns, to monitor the surveillance and all those things, we'll really need to really be a step ahead and leverage technologies. And that might include things like ECHO. Yeah, so that's how I'd put it in a nutshell. Thanks a lot, Sadipe.
Thanks, and thank you so much, Dr. Kozia. Thank you to Hassan. Thank you both for making out the time out of your busy schedules to be with us here today and to share from your wealth of experience, knowledge that will improve each and every one of us individually and collectively as well. At this point in time, I would like to quickly move on to the next section on the agenda, which is questions and answers from the audience. I would like to ask if there are questions from the audience, which the panelists would answer rather. So if there are questions, kindly indicate so that this can be taken quickly and provide answers. Thank you. So do I assume that we do not have any question?
All right. Hello.
Yeah, good afternoon.
Yes, good afternoon. Good afternoon, everyone. My name is Chris Maida. I'm calling from Cameroon. I want to thank the panelists for the detailed description and informative that they have given us about the emergency situations in Africa and the briefings on what they are doing in Somalia and Zambia. Now, I happen to have also participated in the designing of an emergency outbreak center, especially in Cameroon here. And I have this challenge that I observed. I would just want to give it and then maybe hear from others what they are doing to address it. We cannot really have an emergency center that has no financial support. For instance, if there is an outbreak now and it demands that 20,000 vaccines should be produced or samples should be collected and sent to the lab for analysis, does the emergency center, does it have that package and that amount of money, because we had emergency centers here, and during some outbreaks like COVID, definitely they could do nothing, because they were limited in research. They did not even have the powers to demand or command resources or money to be deployed for actions to be taken as soon as possible. And we know that most outbreaks that we have are often concerned about contagious diseases. And the more time we waste, the more it spreads to the people. So I don't know, in the package of delivery that you guys are putting in place for the centers, how is the financial capacity of these centers? That is what I really want to know. Thank you, and over.
So in responding to your question, we know that the EOC belongs to the country. In essence, what we're saying is that even though the Bill and Melinda Gates Foundation finances the EOC, and even though North Africa supports in setting up the EOC, ultimately it belongs to the country. However, we understand the economic situation at present, and the BMJF also recognizes this fact. And in setting up the EOCs, provisions have been made to ensure that they get a basic form of support until the government is able to take over. And the reason why this is particular, because we know that government budgeting cycles are fixed and they are strict. So in essence, by the time we complete an EOC, it's not usually budgeted by the government to support that EOC because the budgeting cycle would have ended. And so therefore there is a space where the partners, the Global Polio Eradication Initiative through the BMTF, supports the EOC financially until such a time when the government can take over. So basically that is the way we set up the EOCs, and to ensure that the EOCs have a minimal financial capacity to be able to run effectively. With the issue of vaccines and vaccine productions, that is basically in the hands of the Ministry of Health of each country. So probably Dr. Kuzia could shed more light into how vaccines are obtained in Zambia, or the modalities for the distribution of vaccines in Zambia. Dr. Kuzia, please.
Thank you. To start with, that's $1 million question with $1 million answer. Resources are something that are quite a challenge in most of the places. But I strongly believe that the beginning point is establishing a coordination center. And that really helps to reduce the pressure, because you'll have done the first steps. And then I can give an example in the response to the COVID. Initially in the response, it was very difficult, but as the Emergency Operations Center was established, you begin to see that in that structure and that system, you also have got the finance arm that really comes and plays a role, an important role, and you begin to get stakeholders buy in, and leveraging on some of the work that already exists, they begin to fund that sort of finance. And so, and I think that's how we moved here in Zambia. We had a lot of private sector come on board and support the financing and the movement of that the EOC. And I do know right now that the EOCs partly supported by donors, by our partners, and partly supported by the government. And so there is that integration that also helps to have a sustainability aspect, because you're building capacity amongst the staff, and that as soon as the donors withdraw, you are able to continue moving on. And then when it comes to vaccines, I think vaccines, that's it's something that the government continues to negotiate with different, with WHO and other providers of vaccines. And these are some things that I think as governments, as ministries of health, we know that we cannot do without vaccines when it comes to responding to a public health emergency. And so all resources, really, we really are mandated to find resources and to put vaccines there. And so in Zambia, we did manage, I think we did manage to procure some, especially for COVID. And also we did get some donations through the COVAX system that was established by WHO. Yeah, thank you.
Yes, thank you so much, Dr. Kozia, for that input into the question that was asked. So right now, keeping an eye on our time, I would like to invite Hassan to give his closing statements.
Thank you very much, Felipe. Thank you, Dr. Kozia, and all of the participants. And I have enjoyed this webinar very much. Having platforms that will connect countries together and partners that are working in the same field is always a plus for us. We enjoyed this, and we hopefully and would want this to continually happen, so we can learn of each other and benefit each other onto the best how we can improve health in our countries in Africa. And again, I thank you very much again.
Thank you so much for that, Hassan. Dr. Kozia, your closing statements, please.
I think for me, it's just thanking you, Sodipe and team, for this privilege to share the work that we are doing in Zambia. And thank you for the opportunity to learn what is going on across the Africa and in Somalia. Thank you, Hassan, for being quite elaborate and sharing your experiences. And I think these platforms, I can't agree more with what Hassan has said. They really provide a best sharing platform where you see how we can work together in a unified manner as Africa to respond to our own challenges that are affecting us as a continent. And we will quickly learn that these things are common, and there are always solutions to solving these problems, especially when we unite and just share our experiences. Otherwise, thank you, Sodipe, very much, and we'll be willing to continue working with you on another opportunity arises. Thanks.
Thank you so much, Dr. Kozia, for that. Dr. Kozia Ziambo from the Ministry of Health in Zambia, as well as Hassan Mohammed Ali from the Ministry of Health in Somalia. Thank you both for making our time to be with us here today and for sharing with us a part of the wealth of your experience. And with this, I'd like to yield my mic to the Deputy Director of Programs and Impacts once again for his closing remarks.
Yeah, thank you. I think we've had very extensive conversation. It's good that we're getting really insight into how emergency operational centers, either for polio or for public health, and I love the sharing that happened with how that applies with other programs like the HIV program. And there's some innovations that have actually come into play. I think it's quite interesting to see the value that EOCs bring, kind of contributes to public health, addressing public health emergency, and most importantly, reducing all the case of incidents or managing that effectively in different contexts. So special thanks to panelists for finding time to share this very unique contribution. And we do hope that as we go further with such learning, it will really advance how best we respond to public health emergencies. And we also hope that in the nearest future, some form of scientific evidence will really come out, right, to demonstrate the value of EOCs in the public health space. And thanks to our team internally, and also special thanks to Sheung Sodipe for a great facilitation. And then to our distinguished guests, you really did well to also be part of this webinar. We hope that you keep in touch with our subsequent series. This is actually a monthly webinar series being facilitated by eHealth to discuss different public health innovations. And we hope to see you next time, sometime next month, to be very specific. So thank you, everyone. I will still hand over to Shane for a final wrap-up. Thank you.
Thank you so much, for the support. Thank you to the team, internally and externally in Abuja and Kano. Thank you to everybody. Before we close, I would like to notify everyone that a brief survey will be going out at the end of this webinar. Please kindly fill in, let us know your thoughts. It will greatly help us improve in subsequent webinars. And with this, I'd like to thank everybody once again, our panelists and our guests for making out the time to be with us here. Thank you so much. I hope that we would enjoy the rest of the day and the rest of the week. Thank you.